Confirmed cases 68500. Suspected cases 8228. Close contacts traced 529418. And close contacts under medical observation 158764. Except Hubei, the confirmed and increased cases 188. And new deaths 3. Severe cases reduced by 25 cases. In Hubei province, the newly increased confirmed cases 1843, including 1548 in Wuhan. For cured and discharged cases 849, including 413 in Wuhan. Newly increased deaths 139, including 110 in Wuhan. For the existing confirmed cases 49030, including 35314 in Wuhan. Among this figure, there are for severe cases 10396, including 8530 in Wuhan. For cured and discharged cases 5623, including 2915 in Wuhan. For deaths 1596, including 1233 in Wuhan. For confirmed cases 56249, including 39462 in Wuhan. Newly increased suspected cases 1036, including 391 in Wuhan. And existing suspected cases 5243, including 2168 in Wuhan. In accumulative terms, there are altogether 84 cases reported from Hong Kong, Macau, and Taiwan, including 56 from Hong Kong SAR, 10 from Macau SAR, and 18 from the Taiwan region. By the 24 o'clock February the 15th, Wuhan, Hubei, and the national severe cases have all seen the decline in terms of the proportion. In Wuhan, the highest peak was in January the 28th, and this proportion has been reduced to about 26%. For Hubei province, the peak appeared on January the 27th, and this proportion has dropped to 15.1%. For the nationwide, the highest peak was in January the 27th, and the current proportion has been dropped to 7.2%. That means the national efforts against the epidemic have shown results, in particular with the strengthened support from other parts of the country and also the local efforts in Hubei province for suspected cases and the feverish patients who may have been affected by the epidemic. They are now taken in the relevant quarantine places, and this has laid a solid basis for the reduction in the severity of the epidemic. Now the Q&A part, and please identify yourself first. The first question on the left, on the third row. Thank you. From Xinhua News Agency. Since the outbreak of the epidemic, the country has worked out sound mechanisms. Could you please share with us the details of such mechanisms and the progress that has been made? Let's have DDG Zhou to answer your question. Since the outbreak of the epidemic, following the Central Committee of CPC and State Council's guidance, we have set up the joint mechanism, and we follow the rules and laws and identified Wuhan, the epicenter, as the top priority for the control efforts. And we have also identified the transmission pathways or the train as the priority for close monitoring. So under this joint mechanism, a series of specific measures were worked out by the relevant government agencies to control the spread of the epidemic. In the light of the dynamics in epidemic control, we make constant improvement to the existing plans and measures in various aspects like the epidemiological surveys and the close contacts tracing and management. We have all worked out specific measures. Furthermore, we have differentiated community-based approaches. The communities are all mobilized for grid management, and also we have the blanket style tracing and management. For travelers from the epicenter to other parts of the country, they are closely monitored and requested to report to the destination communities. Also, we have banned the trading and the marketing of wildlife. We have shut down the wildlife markets to contain the potential risk of spread. Also, in terms of the infectious disease control, we have adopted measures like disinfection in public places and also in the transportation conveyances. Also, we have extended the spring holiday break. We encourage people to stay at home or work from home. Also, for travelings and the public gatherings, we have strengthened management to reduce such public gathering and minimize the unnecessary travels. Also, we have conducted the patriotic health campaigns in the winter.
Seafood market, agro-produce markets, live poultry markets have been the focus of our prevention and control. We've also stepped up sanitation in communities. For the protection of a susceptible population, for the elderly, children, students, pregnant women, maternal women, and other key risky groups, and also those in kindergartens and in nursery homes for both the children and the old-aged, we've compiled prevention and control guidance. For the general public, we have drafted protocols on the use of face masks, home stay protection, and also the sanitation and hygiene in public places. Video clips, cartoons, and leaflets of know-hows have been used to enhance the public awareness so that they will be the people who take care of their own health. They have also mastered some protection skills by reading these popular science publications. We've also mobilized the entire population into our efforts. For the next step, we will follow the deployment of the State Council and the Party Central Committee and the Joint Prevention and Control Mechanism. We will look at the changes of the epidemic, the progress of our prevention and control. We will continue to make efforts in accordance with law and in a scientific manner. Thank you. Next question, please. Journalist on the right side. From the second row, please. Thank you, Mr. Chair. I'm from Dragon Television. Starting from the 31st of January, community health services in Shanghai have made outdoor visits to take temperatures and provide some preventative drugs. Community prevention control is the forefront of the entire prevention and control efforts. So my question is, what are the specific efforts made by grassroots level health institutions, I'd like to ask DDG Zhu Hongming from the Grassroots Health Service Department of NHC to take the question 246. Community health centers, starting from the 31st of January, began their normal operation. Among all these health service centers of the community, 34 has fever clinics and 24 are operating 24/7. So this is an embodiment of the services provided by the grassroots level health institutions. 4 million community health workers have all been mobilized into our campaign, and they have played essential and unique role in prevention and control. I'd really like to sing high praise for these community health workers. And I'm referring to the health stations, the community clinics, and also the clinics in city and rural areas. 1.44 million rural doctors, village physicians. The grassroots level or community level health workers have been doing the following 3 jobs. First, they have been taking care of their own responsibilities, including triage, pre-training, pre-screening, the identification of fever patients, and they have done a good job in quarantine and referral. Second, they have also carried out the regular diagnosis and treatment, just as the journalist has rightly commented. At critical timing like this, we should continue with the regular efforts in managing NCDs, triage. Special attention should be provided to the old-aged, and also the continuous efforts is made in vaccination. Besides, the community health workers have also been working with the community citizens to safeguard our homeland. The fine-toothed combing has been carried out. Great management was implemented. Homestay quarantine and observation had been carried out. Once a suspected case is identified, the community health workers will go to the families and give the notice of home quarantine. Daily contacts and visits have been maintained for temperature monitoring, and once they are off medical observation, notice will also be given to the individual or individual family. The community health workers have also been engaged in epidemiological survey as well, so they have been working closely with the community residents to safeguard our homes. Third, solid efforts have been made in ensuring the entry control at airports, the highway stations, railway stations, and also community gates. You will find the work carried out meticulously by the community health workers. In particular, there are many young participants who were born in the 1990s, and they have been the main backbone in this fight. The community health workers at this critical moment have been dedicated to these efforts. Epidemic-free community is our aspiration, and communities should become the important safeguards of the entire nation's safety. Such success cannot be separated from the community health workers and community police officers. Also, the property development and safeguarding people. Of course, community residents' support and understanding are also essential in this battle. As we are recovering and resuming businesses, more people are returning to workplaces as well as the communities where they live. People receive different alerts and notices by WeChat, short messages, or even some paper written notices. Now, I have one from Beijing. authority, you may have already seen this paper. We are from the community. We are the community workers and volunteers. We have knocked on your door several times previously. After you have seen this paper of notice, would you please contact us, report to us your health status. If you and your family have come back from other places, please scan the barcode for registration. Thank you for your support. So I like to advocate the community residents. If you have received such paper notices, please follow up and give us your due support. Thank you. Next question, please. On the right side from the second row, journalist, please. Thank you. I'm from CNR with CCTV Group. There has been some media report that because of the tight medical supplies, the community workers may wear their face masks for several days without any replacement. Without surgical masks, they have to wear the dust prevention masks, and also they are very understaffed. Their knowledge and skills of prevention and control are inadequate. How should we respond to such issues? I'd like to again ask DDG Zhu Hongming to take the question. I'd like to make some clarification. Community health workers do not take the responsibility of the diagnosis and treatment of novel coronavirus pneumonia. Still, patients need to go to the designated hospitals. Community workers' major responsibility is screening, identification, quarantine, and referral of the patients. So journalists have identified some problems. Some problems do exist. The medical supplies are in shortage in some areas, and in some places there are understaffing. The Joint Prevention and Control Mechanism has been advocating medical supply allocation to the community level. We have also asked localities in their allocation of medical resources, supplies should be provided to community workers as well. Next question is about staffing. Yes, they have been working on the 3 priority areas as I have mentioned previously. Sometimes we need a better division of work and a synergy. And also the consortium of hospitals have also come into play. Shortly before, I went to Hunan and I inspected the work carried out in Yuhu district of Hunan. In one of their villages, they are understaffed. However, we've noticed that the upper level hospital, Changsha Hospital, has lent some doctors to the village hospital on a rotation. I think such collaboration can be rolled out.
Also, in order to improve the capacity at the community level, we've conducted a lot of training. We have the Chinese Medicines Continuing Education Network, and this electronic platform has 2 dedicated columns, one for the village doctors and the other for the clinical doctors at the community level. We are constantly updating the training materials on the e-learning platform. According to available data, 780,000 people have received such online training with the e-learning platform. Let's continue. On the 5th row on the left, the journalist in yellow. Thank you. From Beijing News, it is reported that the household visits are quite consuming, and also there are so many paperwork to be done by the community healthcare workers. So are there any measures to improve this procedure? Let's have DDG Zhu to answer the question. I can see you are very interested in the grassroots level healthcare work. As for the workload, actually at the start, we found that the community healthcare workers are very busy. They have a very heavy workload. So they must emphasize efficiency and avoid the waste of time on the duplicated work or paperwork. It has already been noticed that such paperwork is very time-consuming and exerts a lot of heavy and unnecessary burden on the community healthcare workers. That's why through the joint control mechanism, we worked out policy bulletins and requesting the community healthcare workers to be relieved from such heavy and unnecessary workload. The epidemic control work is quite busy, so except those necessary forms, all the unnecessary paperwork should be suspended. Also, information should be better shared. So our idea is that with the joint control mechanism at the national and at the provincial levels, we can share the data. For community healthcare workers, they should be devoted to the clinical practices. Meetings should not take up too much time of our healthcare workers. So we wish to encourage information sharing. Also, we have encouraged the adoption of the internet technology and the WeChat or other direct reporting approaches to make the reporting efficient and accurate. Okay, let's continue. On the right, the gentleman on the third row. Thank you. I'm from China Health magazine. One netizen complained that when he brought his mother to the community clinic, the clinic could not provide the mask to the patient, and this may lead to the risk of in-hospital or in-clinic transmission. So what is the solution to that? Okay, we will have Mr. Li to answer your question. Since the outbreak of the epidemic, the communities have been mobilized to prevent the further spread of the epidemic, and there have been a lot of efforts made at the community level. First, we have the triage in the community clinics. For those patients with fever, they are referred to the designated hospitals, especially the fever clinics. Also, for people who traveled back from their spring holiday break, they will report to the community, and then the community will follow this particular person very closely to relevant services. Also, together with the neighborhood community committee, for people returning to the community, we will verify the information, and for close contacts in the communities, they will be transferred by the community to the designated hospitals. Also, at the community, we have knowledge and awareness promotion campaigns, as well as psychological support to the community people. So we have done a lot of work, and also to prevent the potential in-clinic transmission, as you have mentioned. we have the triage approach adopted in the community clinic. Then the community clinic will be facilitated for the regular patient receiving and treatment, while for the suspected cases, they will be transferred to the designated hospitals. For community people with NCDs, we have also worked out the convenience approaches so that people do not need to come to the community clinics to have the prescriptions. Also, we constantly follow up the patients, the NCD patients, and the community people. Also, backing the community clinic, we have the specific accountability system and approach for disinfection, and especially for in-hospital potential risk of transmission. For suspected cases identified at the community level, we will have the on-site quarantine and isolation, and we will report directly to the relevant hospital, and there will be ambulance dispatched to send the patient to the designated hospital. And also we will have disinfection after the patient leaves. Let's continue. On the left, on the front row. Thank you. From China Family newspaper. Now we have more and more people coming back to work, and residents may find some suspected cases in their community. So for such community, do they need to be closed for better management? And also, how about the residents in this particular community? Are they all identified as close contacts? We will have Mr. Zhou and Professor Feng to answer your question. Thank you. Approved by the State Council. COVID-19.
NCP has been included into the second class of infectious disease, but prevention and control have been carried out according to the Class A infectious disease prevention control. National Health Commission has worked out community prevention control protocol. Classified prevention control measures have been adopted. For communities where there are cases or where the epidemiological history is clear, there is a cluster of cases. For communities as such, we need to quarantine the cases. At the same time, the isolated and collective medical observation must be carried out. For the spreading in communities, when necessary, measures can be adopted as appropriate to prohibit the entry and exit. Under the guidance of this protocol, provinces have worked out their individual prevention control strategies and also the working measures. Thank you for your question. I'd like to make some additional remarks. According to the NCP Prevention and Control Plan, the 4th edition, close contacts are defined as those who have had close distance contact with the confirmed cases without precautionary measures. For example, family members who live under the same roof, those who take care of the confirmed cases, or who have been in the same lift or in the same room dining, those who have dined together or engaged in some recreational activities together with the confirmed cases. So as to the question whether community resident can be defined as close contact, it depends on the place, the time of the contact. It is not appropriate to define the entire community as close contacts. Thank you. Next question, please. From the left side, the 3rd row. Thank you. We've noticed that there is such a report in a place, a husband, a wife, and children, with the children in the family have been quarantined. 10 days later, there has been onset of symptoms, and the husband was confirmed as a confirmed case. NAT tests for the wife and the children are asymptomatic patients. So my question is, there is an increasing number of the close contacts. So people may fret over such increase and quarantine measures for the close contacts. Should they be quarantined at home, or should there be mass quarantine? If it is mass quarantine, what is the accommodation conditions? Can localities provide such accommodation? Which news are you with? I'm with the Yangtze River News. I'd like to ask senior consultant researcher Feng Luzhao from NHC to take the question. Thank you for the question. According to the existing management measures on close contacts, we should provide mass quarantine and medical observation. But for some places where there are not such conditions, and also for some vulnerable groups, like the infants, young children, or those dependent, old-aged, under the guidance of the community health workers, they can have the home quarantine. However, the management and observation must be stepped up for home quarantined close contacts. You've also asked a question, the selection of the mass quarantine places and the facility requirement in the 4th edition of the Prevention and Control Guidance. We've put forward some suggestions. Localities may requisition the hotels or schools as the places for mass quarantine. Thank you. Next question, please. A journalist from the first row of the left side, please. I'm from CNR International Channel. As we've discussed, community health workers are understaffed. But we've learned that community workers have been reallocated to support the highway entry control or the railway station inspection. So where this put a burden on the already strained community health prevention and control. I'd like to ask DDG Zhu Huangming to take the question. Yes, we've noticed this very issue. Community health workers are under great burden and pressure. Apart from doing a good job in community prevention and control, many of them have been reallocated to airports, ports, docks, highway entry control points. Many grassroots level health workers have been transferred to other places to provide help. I believe this also belongs to the work area and work stream of prevention control at community level. Such work has identified many suspected cases. Yes, community health workers are understaffed. However, the allocation of human resources must be tailor-made to the actual needs of prevention and control. Of course, there can be some fine-tuning or reshuffling. Simple work can be transferred to volunteers. The community health workers can continue to focus on technical training, technical support. There can be a better allocation of labor. Also, internally, there should be better reshuffling to ensure the community work can be carried out, diagnosis and treatment can be ensured, and some of the human resources can also be allocated to rural areas. And also we should go to the entry control points. And again, we are indeed understaffed. We need support from across the society, like the human resources lent to us from higher level of hospitals, or leveraging the mechanism of hospital consulting. Professionals can also be allocated to community level to give proper guidance. Thank you. Next question, please. A journalist from the second row of the right side from CNS China News Service. Localities have resumed their businesses. Some communities have adopted extreme measures. Those who work during the day cannot come back to the community in the night. And there are some very harsh and draconian measures adopted. Are these draconian measures really helpful, or will they bring higher risks? I'd like to ask DDG Zhou Yuhui from the Disease Prevention Control Bureau of the National Health Commission to take the question. Thank you for the question. NHC has worked out community prevention and control plan, putting forward very specific provisions. Given the specific severity of the epidemic, community without case, community with cases, community with cluster cases have been classified, and also community with the spreading of the epidemic, there has been classified measure adopted. At the entry-exit point of community, there can be infrared or other temperature monitoring conducted. However, there shouldn't be prohibition of people coming back from work to their homes. At the current stage, there are also many medical workers who need to go back home. We also have those who are working as police officers in the energy, transportation, environment sectors who are working directly or indirectly in the efforts of prevention and control. We owe them our gratitude. We must respect their efforts. We must respect those who are working at the forefront. Thank you. Next question, please, from the fourth row of the left side, please. Thank you. I'm from Shanghai Wenhui News. Shortly before, China Physician Association Secretary Zhong Xuezhen has mentioned that GPs and family doctors play an essential role in this prevention and control. What are their specific roles compared with the specialized physicians? When GPs are engaged in the prevention and control, what have been their difficulties and bottlenecks? How can we help them to prevail over the difficulties? I'd like to ask Li Yongji from the Jingsun Community Health Service Center to take the question. General practitioners play an important role in the mass prevention and control. The GPs
and the neighborhood committee have the joint mechanism. We have the family doctors or GPs working around the clock to answer phone calls from the community residents and offer guidance for epidemic control. Also, our nurses in the clinics conduct the triage and transfer the suspected cases to the designated hospitals. Furthermore, the prevention healthcare professionals are conducting the household visits, the follow-up monitorings, and also the community clinic disinfections. For the symptom monitoring and the close contacts tracing and verification are also done by the family doctors or GPs. Furthermore, the GPs are responsible for the transferring of the suspected cases. The GPs are using the online tools to answer questions from the residents and also offer health guidances. Specifically, there have been a lot of detailed work done by the GPs. we may get in contact with the suspected cases. So there is a risk of infection. So it is necessary to increase the protection for the GPs. Furthermore, GPs receive more training during the epidemic. Such trainings cover many aspects like disinfection, and also their communication skills are strengthened. We need to show care to the community residents as well as to the community healthcare workers. Let's work together to fight against the epidemic. Last two questions, please. On the right, on the fifth row, from House newspaper. I have a question for quarantine or isolation. In some localities, hotels and restaurants are requisited as quarantine sites or isolation sites. So may I know which are the sites for such requisition purpose, and how about the transfer of patients afterwards? Thank you for your question. In order to ease the pressure on the community clinics and ensure the timely treatment to the suspected and confirmed cases, NHC has worked out a plan to have the medical observation on the suspected cases, and there are specific descriptions about the quarantine places or sites that you have mentioned. First, they should be around the designated hospitals. In principle, such sites should be accessible on foot and can be close to the designated hospital. Also, such facilities should have independent bathrooms, and also the room for temporary storage of medical wastes. The elevators in such sites should be able to accommodate the specific facilities to transfer the patients. For the isolation targets or the isolated quarantined people, we will have observation and make the decision whether to transfer this particular case to the designated hospital. If the symptoms get worse or there are other symptoms, then this particular case should be transferred to the designated hospital or the relevant hospital. After the quarantine, if this individual is confirmed not as an epidemic-free patient, then he or she should go back home. Okay, last question. The lady over there on the third row. Thank you. From National Business Daily. At the moment, in railway stations and office buildings, the infrared temperature monitoring equipment or devices have already been installed. Can such devices accurately tell the fever patients? And is it possible to have this device installed in all public places? We will have Professor Feng to answer your question. Well, infrared thermometer has already been proved as a very convenient device to take temperature and identify the fever patients. It can check the body temperature of the crowd very efficiently. So it is quite safe and convenient and is an effective way or tool in public places. However, its accuracy might be affected by many variables, and we suggest the localities to make the decision by themselves whether to install such devices or not. Okay, that's all for the Q&A, and we will have research fellow Professor Feng to give us the health tips. Okay, I'll answer the questions put forward by the netizens. And the first is, will the shoes bring the virus back home? How to disinfect the shoes? Well, for COVID-19 pneumonia, it is transmitted mainly by contacts and droplets. So your shoes, it is not necessary to disinfect your shoes, but you are suggested to change shoes at the doorstep. The second question is, it's quite cold these days, and which part of the body is the most accurate part to have the to take the body temperature? Well, as I have mentioned, temperature monitoring is a very effective way in the epidemic control. The use of the infrared thermometer should follow the instructions, and there might be some variations concerning the results from different parts of the human body, especially in cold days. So it's necessary to calibrate the infrared thermometer, especially in outdoors. So for people who come indoors from outdoors, it is suggested to get the temperature from the body parts where have been covered by the clothes.
And the contact of skin is necessary. It's not necessary. Therefore, there is a very low likelihood of a cross-infection. The fourth frequently asked question is whether air purifiers can filter the virus. The most commonly seen air filters use the fan coils and also the filters. One is for the inlet of air, and the filters in the air purifiers will absorb the pollutants and then breathe out the filtered air. Air purifiers are used to prevent and fend off pollutants, but in their product specifications, there are no specifications on the killing of virus or pathogens. Therefore, air purifiers may not necessarily kill or filter the virus. Therefore, we still suggest ventilation of the indoor environment. It can be natural ventilation or mechanical ventilation. However, given the current cold season, when you open the windows or doors for ventilation, you should pay special attention to the risk of catching a cold. Thank you. I'd like to thank the guest speakers. We have been focusing our questions and answers on prevention and control efforts, which has entered into the most critical stage. Health workers, in particular community health workers, are working at the front lines. They are dedicated to the great efforts, and they are earnestly implementing the measures to prevent against the input of the risks and the spreading of the virus. They have built the great wall of people's prevention and control. As Dr. Tedros of the WHO has pointed out, no one can be isolated from the epidemic. We must bring our efforts together. In this people's war, many who are not health workers are also working at the forefront. All of us should concert our efforts to prevail over the difficulty. Tomorrow, at the same time, we will continue with the press conference, and I welcome your continuous attention to the press conference. You are more than welcome to forward our questions. We conclude today's press conference. Thank you.